Hi, once again, I'm Dr. Yen Reyes. I chair the Infection Prevention and Control of Medical Center IMUS, South IMUS Specialist Hospital, and the Dasmariñas City Medical Center. As of today, June 15, 2021, a lot of employees are still having COVID. So I think in the Philippines, every department, every office has a COVID story. And it is not uncommon that a patient or an employee has COVID. So, since the start of the pandemic, there are a lot of changes in protocols. Like, for example, if a person has COVID before, uh, when the vaccine was given prior to March, they have to wait for 90 days when they have when they are already cleared of the COVID before they will have their vaccine. But for now, even if the patient has COVID, they don't have to wait for 90 days anymore. They can have vaccine just as long as they are asymptomatic and they are cleared by the physician. Okay, so we will now talk about COVID in the workplace. So this is particularly about healthcare workers' algorithm for COVID exposure in our hospital, and this is applicable in our three hospitals, and we can share it with you because we can also share what are the good practices among hospitals. So these are our updated guidelines. So every time, so like for example, during the start of the pandemic, we have a different protocol for healthcare workers or employees who has COVID. But now we keep on changing it because since coronavirus is a novel virus, it is a new virus. There are new variants, and then it keeps on changing. So we also keep on changing our policies to swim freely with this pandemic. And even the WHO, World Health Organization, and the DOH, they keep on updating their policies and guidelines. So this is our policy. If the healthcare worker is exposed to COVID, we have to, and if they are tested, we have to differentiate if the COVID test is positive and if the COVID test is negative. So if they are symptomatic, this will be our guidelines. So if they are symptomatic, we have to differentiate if they have mild or moderate. But if they have symptoms, if they don't have symptoms, if they are COVID positive but no symptoms. So what are the usual symptoms? Usually headache, fever, conjunctivitis or watery eyes, colds, cough, no sense of smell, and no sense of taste, walang ganang kumain, napapagod, masakit yung mga muscles, yung iba nagda-diarrhea, ang iba rashes. So kung COVID test positive naman siya, pero no symptoms, 10 days isolation lang siya from the date of specimen collection. Like for example, if April 1 yung specimen collection, so mag-compute lang siya ng plus 10 days, so April 11. Then on the day 11, mag-secure lang siya ng medical clearance from infectious disease sa pulmo or the attending physician or pwede din sa resident on duty sa emergency room. However, pag may symptomatic siya, i-differentiate namin kung may mild siya or probable COVID or moderate, severe, or critical. So yung mild siya, meron lang siyang mild symptoms like simple cough, simple colds, walang panlasa, or mild fever, ganun lang din siya. 10 days of isolation from the onset of illness, and if clinically recovered for 3 consecutive days. So, 10 days lang ang computation natin, pero dapat 3 days siya na walang symptom-free. So, on day 11, punta na siya sa attending physician niya, hindi na siya ng clearance, pwede na siya mag-work. However, pag moderate or severe, so starting mag-moderate, meron na siyang chest x-ray findings of pneumonia. So especially pag adult, pag more than 30 na yung respiratory rate, hirap na siyang huminga. And especially pag ang yung pulse ox, yung oxygen, chine-check sa oxygenation ng body natin, lalo na pag less than 90 or even if 94 and below. So most of the time, pag nasa moderate to severe or critical na sila, 21 days isolation na siya from the onset of illness. And then kailangan niya ng medical clearance, day 22, from the pulmo or the infectious. So kung COVID test positive naman siya, tapos no symptoms, 10 days isolation din. Tapos secure medical clearance. So ito naman pag COVID test negative na siya. Tapos no symptoms, pero i-differentiate natin kung meron siyang high-risk exposure or low-risk exposure. Kung high-risk exposure siya, 14 days quarantine. Ang 14 days quarantine niya, so mula nung na-expose siya, 14 days yung computation natin. If asymptomatic siya on day 15, secure lang medical clearance from IDS or pulmo. So yung high-risk exposure, siya yung i-discuss natin to thoroughly mamaya. Pero siya yung within 1 meter from the patient who is confirmed. Tapos more than 15 minutes yung interaction nila. And then dun sila sa enclosed room. At saka wala siyang PPE. So wala siyang face mask, wala siyang face shield. Yung low-risk exposure naman, complete yung PPE niya. So naka-face shield siya, naka-face mask. Pero kung wala naman siyang symptoms, clearance lang ang kailangan niya from the infectious or the pulmo, and report lang siya sa Human Resource Department before reporting to work. Kung symptomatic naman siya, i-differentiate pa rin kung high risk or low risk. Kung low risk naman, i-isolate and monitor until resolution of symptoms. At saka kailangan lang niya ng clearance sa infectious or sa pulmo or attending doctor. Kung mild or probable, 10 days isolation. Kasi COVID test negative siya eh. Tapos symptomatic. So, mild or probable, 10 days lang yung isolation niya. Dapat 3 days lang siya na wala talagang symptoms. Like even cough or colds or fever, no symptoms for 3 days. Kailangan lang niya ng medical clearance on day 11. Pero, kung starting moderate na siya, severe or critical, dapat 21 days of isolation niya from the onset of illness. So from the onset of illness, magbilang ka ng 21. Even if COVID test negative siya para symptomatics, pero pag nakikita ng attending physician na COVID talaga yung presentation, ito pa rin yung protocol natin. So ano yung mga return to work protocol update? So i-define muna natin ano yung close contact. A close contact is a person who has experienced any one of the following exposures during 2 days before to 14 days after the onset of symptoms of a probable or confirmed case. Like for example, Monday, nagsabi sa'yo yung friend mo na, "Oy, may COVID pala ako." Tapos kausap mo siya sa Saturday. So ibig sabihin, 2 days before, pasok ka sa criteria na close contact. Even after 14 days from the onset of symptoms. So kung, lalo na pag may face-to-face contact ka with a probable or confirmed case within 1 meter for at least 15 minutes. So yung face-to-face contact, like for example, nag-work ka sa accounting department. Tapos kumain kayo sabay. So ang upuan nyo less than 1 meter, tapos nagtanggal kayo ng face mask, nagtanggal kayo ng face shield. So face-to-face contact yon. Kaya as much as possible ngayon, in all our employees, we advise them to eat alone or eat in your desk, or kung kakain man, dapat 1 meter apart. Or as much as possible, even in our operating room, yung mga nurses namin, ina-encourage namin na 1 table, 1 chair lang para isa-isa silang kumakain. Kasi the moment kasi na you will remove your face mask and your face shield, ma-open ka na eh. Magiging high risk exposure ka na. Or meron kang direct physical contact with a probable or confirmed case. Like for example, ikaw yung nagbabantay ng matanda. Tapos yung matandang yun, incidentally nagkaroon ng COVID, so meron kang direct physical contact. Close contact pa rin ang tawag doon. Or direct care of a patient with probable or confirmed COVID-19 disease without using recommended personal protective equipment. So wala kang PPE na tinatawag, so wala kang face shield, wala kang face mask, so close contact ang tawag doon. So ano naman yung first generation close contact? Ito na yung close contact of a probable or confirmed case. Like for example, ikaw, nasa, Human Resources Department, tapos sabay kayong kumain ng friend mo. So siya nagka-COVID, so ikaw yung first generation contact. So ano naman yung second generation contact? Close contact of a first generation close contact. So kung ikaw, first generation close contact ka, umuwi ka sa bahay mo, Tapos yung husband mo, second generation contact yun. Ano naman yung third generation contact? Close contact of a second generation close contact. So yung husband mo, second generation siya. Pumunta na naman siya sa office niya. So suway naman siyang kumain ng office mate niya. So third generation contact yung office mate niya. Pag magsi-severe illness yon, kasama yon sa contact tracing up to the third generation close contact. Ano naman yung general contact? It is beyond 1 meter and don't have a prolonged interaction or direct contact with a confirmed case. Like for example, sabay kayong kumakain ng friend mo, may security guard na dumaan, tapos nag-wave lang siya, more than 1 meter naman. So general contact lang siya. Hindi porket napadaan siya at nagbabay siya, close contact na rin siya, magre-require na rin siya na magpapaswab din. Kasi yun yung problem kasi lahat even after the third generation close contact, gustong-gusto magpapaswab lahat, especially pag nagpapanik na. So kinakategorize namin yan, especially pag may allocation of resources, kinakategorize namin kung sino yung first generation contact, kung sino yung nangangailangan ng swab, at saka sino yung under close observation lang. So ano yung quarantine? So quarantine is, kung ikaw yung may sakit, at positive ka, i-isolate mo yung sarili mo for 14 days. Ang quarantine naman is kung ikaw ay na-expose at negative ka pa naman, magka-quarantine ka para hindi mahawa yung iba. Yung quarantine, yun yung other person na negative naman. So isolation is para sa mga positive persons lang. Okay, so kung ano naman yung quarantine, it is a single room confinement. So separate toilet and bath, no contact with others, and no sharing of utensils. Kasi under quarantine ka under close observation ka. Sino yung mga high-risk exposure? Ito na pinag-usapan natin. Exposure to COVID-19 positive person with no mask and face shield. Exposure niya na more than 15 minutes in an enclosed space and less than 1 meter apart. So ano yung confirmed cases? Can be isolated depending on the severity of symptoms. So ito na yung pinag-usapan natin, confirmed cases. Kung asymptomatic siya, ito na yung nasa algorithm, 10 days isolation lang from date of specimen collection. So medical clearance on day 11 from your attending physician. Kung home isolation, kasi nga, ano ka lang naman confirmed na asymptomatic, home isolation, kaya na to. Or secure clearance from the barangay. So if community swabbing was not done by the barangay, pwede naman tayo mag-request ng swabbing, pero depende kung wala ka talagang symptoms and there is allocation of resources, pwede nang hindi magpa-swab. How about confirmed ka, tapos mild case? Mild case is mild sipon, mild ubo. 10 days lang din isolation from onset of illness. Medical clearance, after that, day 11 from your attending physician. Kung home isolation, secured and clearance from barangay. However, kung moderate, severe, and critical cases ka na, like for example, a pneumonia na talaga yung x-ray mo, dalawang parts na ng lungs, tapos nahirapan ka na huminga, more than 30, tapos yung pulse ox mo, less than 90 na, tapos may changes in sensorium ka na, nagdadiarrhea na ng husto. So, pag moderate ka na, nasa category ka na, most of the time, dapat ma-admit na yon. Should be admitted and managed accordingly. Tapos, yung isolation mo is 21 days from the onset of illness. Yung secure medical clearance on day 22 from your attending physician, and then after that, return to work policy na. However, kung high risk ka naman, or first generation from confirmed case, pull out from work. Dapat hindi ka na talaga mag-work. Kasi nga, first generation exposure or kung high risk ka. So, kung symptomatic ka, if ever magsi-symptoms ka, isolate for 10 days from onset of illness. We do RT-PCR, ideally on day 5 from the onset of illness. And after that, you can secure clearance on day 11 from the attending physician. But if symptoms worsen, dapat admit ka and to be managed accordingly kung magmo-moderate ka na. Kung moderate or severe, should be admitted and managed. So there should be 21 days isolation and secure clearance on day 22 from your attending physician. And then after that, bring your medical clearance to the Human Resources Department, and then you'll have your return to work clearance na. However, kung asymptomatic, wala ka namang symptoms, quarantine lang for 14 days from the day of the last exposure. Ang computation ng quarantine from the day of last exposure, hindi yung time na nagkita kayo. Hindi yung time na una kayo nagkita, but kundi yung last exposure. Like for example, pumapasok pa yung positive ng Monday, Tuesday, Wednesday, Thursday, Friday. So ang computation nyo, hanggang Friday kayo nakikita, mula Friday. Kasi yung from the day of last exposure. So do RT-PCR on day 5 of the last day of your exposure. So kung Friday, Saturday, Sunday, Monday, Tuesday, Wednesday, may option ka na. By Wednesday, pwede kang magpapa RT-PCR if there are resources. But if the healthcare worker or the employee is asymptomatic by day 14, kailangan lang yan ng medical clearance on day 15. So, vacation leave. So, uso na rin ngayon ang nag-vacation leave kasi syempre, marami na ring atat na gustong umuwi or gustong umuwi probinsya. So, pinapayagan naman, pero just as long as the healthcare worker coming from outside NCR plus bubble, yun dito yung malapit sa NCR or yung mga malapit na areas from NCR, yun na yung bubble, shall secure medical clearance from your attending physician. So, bago ka pumasok sa work from your vacation leave, dapat meron kang medical clearance. And then show your medical clearance to the emergency room doctor or to the company doctor. Then go to the human resources department bago ka magkaroon ng clearance ng return to work. However, kung naka-vacation leave ka, tapos merong present some symptoms before returning to work. So may cough, may colds, walang panlasa, walang pang-amoy, may diarrhea, may fever, so may symptoms ka na. So, isolate for 10 days from the onset of illness, kung mild lang naman. Do RT-PCR on the day 5 of illness, and secure a clearance on day 11 from ID pulmonologist. Kung mild lang yung symptoms mo, or kung 3 days wala kang symptoms, wala ka ng ubo, sipon for 3 days, tapos nakapag-isolate ka ng 10 days. And if symptoms become worsen, dapat ma-admit ka kung sakaling nasa moderate na yung category mo. So ito na yung algorithm pag ang healthcare worker sa the left side, asymptomatic, wala siyang symptoms pero high risk. Exposure to COVID-19 and close contact. So we already mentioned it that no mask and face shield, exposure of more than 15 minutes in close space. So close yung space nyo, are less than 1 meter apart. And if may symptoms ka, ito na yung fever, chills, nag-chills din, difficulty of breathing, ito yung very common, nahirapan huminga, myalgia, muscle pains, malaise, cough, sore throat, headache, nasal congestion or may sipon, loss of smell, loss of taste, diarrhea, nausea, and vomiting. So itong left side, pag asymptomatic ka, wala ka namang symptoms, single room confinement lang. Separate yung toilet and bath, no contact with others, no sharing of utensils, and monitor for symptoms. Pag nagde-develop ka ng symptoms, RT-PCR on day 5. However, pag may symptoms ka, pull out from work, dapat hindi ka na talaga mag-work. So notify mo yung immediate head, the human resources, and the chairman of your department. Consult the ER. Tapos isolate ka, so single room, separate toilet and bath, no contact with others, and no sharing of utensils. So this is the summary of the algorithm, which we have already mentioned to you. And this is the individual algorithm. So we already talked about this. And if there are no symptoms, so thank you very much for listening. I just hope that you'll stay safe. Always remember to have social distancing 1 meter apart. So don't touch your mouth, your nose, and your eyes with your hands. So as much as possible, minimize eating together so that you will not be exposed when you remove your face mask and your face shield. And always clean your hands with alcohol and with soap and water. So stay safe, everyone. I hope that this pandemic will end.